I'm Melissa.
And I'm Lee, and we are busy mums, company founders, and all-round early learning nerds. Welcome to our podcast, Growing Little Humans.
Kids aren't born with a user manual, so each week we'll try and cover many topics that you guys encounter and worry about each and every day while you're raising your little humans.
Dr Nitin Verma is a highly experienced consultant paediatrician and allergist at King's College Hospital London in Dubai. After graduating his medical training, Dr Nitin completed his paediatric specialty training and allergy degree in the UK. He has been a member of the Royal College of Paediatrics and Child Health since 2005 and joined King's after many years at the UK's Darlington Memorial Hospital, running their paediatric respiratory and allergy departments. Hi, Dr Nitin. Thank you so much for joining us today.
Thanks, Leah, for inviting me over here to share my experience with everyone around.
So, Dr Nitin, can you tell us a little bit about your background and what led you to specialise in paediatric allergies?
Yeah, I'm a pediatrician with special interest in allergies and respiratory pediatrics, like breathing difficulties. So when I started my training, through my senior years of my training, I was doing a lot of respiratory stuff, and I realized a large part of that was linked to allergies.
Right.
So airway allergies and then food allergies, and that hooked me onto the allergy bit of things, and it got me so interested that I did my degree in allergy. So as a expression of my super specialty experience in the field of allergy.
Yeah.
And then it just all kick-started after that, and then became a consultant in the UK, and then started doing my clinics. And then I've been over here for the last 7.5 years doing pediatric work as well as pediatric allergy and respiratory work.
Great. And you're at King's College Hospital London in Dubai?
I am indeed.
And so what are the most common types of allergies that you're currently seeing in children?
So the spectrum of allergies is pretty huge. So you can have food allergies and you can have airway allergies. So food allergies, you can start from very early on in life, like milk allergy, cow's milk allergy. Then you get proper food allergies where, children eat something, they get eye swelling, face swelling, lip swelling, a rash comes up all over the body, breathing difficulties. So they can come with eggs, with milk, with nuts. So the spectrum is pretty huge. And then if you look at the other spectrum where you have airway allergies, like children presenting with a lot of nasal symptoms.
Yes.
Itchy nose, blocked nose, sneezing, watery eyes, and then sometimes recurrent cough or breathing difficulties. Those are more airway allergies. And in this part of the world, you get a lot of indoor air allergens, specifically house dust mite, molds that trigger this kind of problem. Okay. And then you get eczema as well along with that. So the spectrum is pretty huge, and you see a lot of that over here in this part of the world.
And it seems to me that the prevalence of allergies occurring is really on the increase. Is that your perspective? And why do you think that might be? So
you are right in saying that the prevalence of allergies has increased over the last 30 years or so. We don't know why. It's something in evolution of human race that we are seeing more of allergies. So in the last decade or so, what we have noticed is although the prevalence, that means the number of patients have increased.
Yes.
But the incidence, that means the incidence is the new patients who are coming in a population, they have become rather plateaued. Right. So there is some sort of evolution happening. We don't know exactly why. Now, if you look at the underlying reason why this is happening, there are a multitude of factors. I'll take the whole day probably.
Yeah, exactly. And I think we're probably I wonder if one of the reasons that there might be a little bit more occurrence of allergies is because we're using much more ingredients, and which maybe some of them might be more toxic or chemicals just in our everyday lives, like, with skin, putting things on our skin, or washing the dishes, or the washing powder on our clothes and things like that. Do you think perhaps that could have some impact?
You have a valid point over there. So if you talk about skin allergies, yes, that could be associated.
Right.
That putting like artificial ingredients or chemicals on a skin that is already like the barrier is hampered by, say, eczema or some kind of skin issues, it puts you at a higher risk of having allergies. We know that. There's a lot of evidence for that. But if you look at the other reasons why there is higher incidence of allergies, like, food allergies, respiratory allergies, there are multiple factors. So environment could be one of the reasons. An interesting bit of study that came up some years ago was that migrants who come to the adopted countries, they
Yeah.
tend to have more of food and respiratory allergies as compared to their original
Home
country.
country.
Yeah.
Right.
So their environment has a role.
And I
then-
guess that could be, Dr. Neaton, because their body's used to one environment and it's moved to a foreign environment, and everything around them, from the air, it's completely different to their body.
Yeah, that's quite true. I think that could be one of the reasons that your genes just modify themselves
Yeah.
over time. We don't know why, but it
Yeah.
happens.
Yeah.
And this is a well-recognized problem in the Western world, especially migrants going to Western worlds and realizing,
Yeah.
there's more instance of allergies over there. So there's something about hygiene hypothesis as well. So if you have children playing in mucky environment in barns and all the places, you tend to have less allergies as compared to very westernized kind of life where everything is clean, neat.
Yes.
So there is a role for that as well.
Yeah. And is there anything that parents with, especially young children, I'm talking about, babies, is there anything that you think parents can do with new children that will reduce the risk of them getting allergies as they get older?
Yeah, that's a very valid question. And I'll take a little bit of time to help you understand and explain this.
Yeah, sure.
So if you have a newborn baby who is born and is fine, has no eczema, that means skin issues, no allergies, then the likelihood of them having allergies is small.
Okay.
And when parents start weaning, they should try and get all the common allergens into the children early on.
Right.
Not delay it.
So expose them.
Expose them. So you get your normal fruits, vegetables, and then you go to allergens. And when you go to the allergens, do them quickly.
Yeah.
You don't have to wait for 2 years, 3 years, 4 years to do it. You just do it in the first year of life itself as soon as possible. So that's the first scenario.
Early exposure.
Yeah. The other bit is if you have a baby who has early onset eczema. Eczema is skin, like dryness, itchiness of the skin, or skin allergy. If it's severe, or they have some kind of other allergy along with that, like egg allergy, then it becomes highly important to start introducing the allergy early on in the life.
Right.
So when you start complementary feeding, you have to try and get the allergens as quickly as you can.
So if they were allergic to eggs, for instance, so you're talking about actually exposing them to the eggs?
Not the egg, sorry. You can't give the eggs, but the other allergens, the common allergens,
so
like
peanuts or...
That's correct. So peanut butter, you have fish, you have, soya, you have milk. Those things you have to try and get into the children as quickly as possible after you start the complementary feeding.
Okay.
And that's where the allergists can come in, that you can have a skin prick test to these allergens.
Yes.
And then you can, once if they are negative to the skin prick test is basically a test to help you understand whether you are susceptible to react to something or not.
Yes. Yeah.
That's like it's a test that doesn't prove allergy, but that just highlights the likelihood of you reacting to an allergen, the possibility.
Yes.
So if they are negative, then you're less likely to react, and you need to be given these food products as quickly as possible.
So is testing something that you think should be very common? Like, should it be something that parents consider having done, or would it be something that you would only consider taking your child to do if they were presenting with some intolerances or allergies?
Yeah, I would consider that more for children who had higher risk of having allergies.
Right, okay.
And the higher risk category will be children who have early onset eczema, severe eczema, difficult to treat eczema, generalized body eczema. Because there's a lot of evidence that if you have eczema skin, you're more likely to develop food allergies over time.
Right, okay.
So those children become at a higher risk of having food allergies. And for them, it is really important that food be introduced into the gut sooner rather than later.
Early exposure to the allergens.
So the way the body understands how to deal with food when it's given through your mouth is completely different from where the food sticks to your skin.
Right, yeah.
So there's a lot of studies done where children were given, say, for example, you have a baby with eczema on, say, formula milk.
Yes.
But they had formula milk for 6 months, and then testing was done, and they realized that they had allergy to egg and peanut without being introduced onto this into the gut.
Right, yes.
So that is the environment playing a role. Somehow these allergens get stuck to your skin, and the absorption of these allergens from the skin triggers an allergic response in the body.
That's really interesting. I hadn't heard that before.
So it's really important that when you control the eczema really well,
yeah.
and then if possible, once you start complementary feeding, then you get onto these allergens as quickly as you can, in within the first year of life, if you possibly can.
Yeah. And so eczema sounds like it's not a great thing to be, finding early, and that you really need to be on top of it as a parent to try and ensure that they're exposed to those allergens as early as possible, and to just reduce the chances of them developing more allergies.
Yeah, you're right in that. So when the skin barrier is broken, when it's raw, red skin, dry skin, itchy skin, and the food allergen somehow goes through the skin,
right.
the immune system of the skin is more inclined to say, I don't want this on my skin.
Yes.
Whereas if you put this in your mouth is like a gut, like your GI tract starts from your mouth.
Yes.
It is natural, it's God-given to us that you would like to eat and you like to absorb all nutrients from it. So your absorption and your immune system working from this area as compared to this area is completely different.
Great.
So eczema is a well-recognized, severe eczema is a higher risk of developing food allergies over time, especially in small babies.
Right. Okay. And so what is the difference, Dr. Nitin, between food allergies and food intolerances?
So it's more of it's a language, semantics, you can say that. So intolerance, if you say, in common language, they mean essentially the same. But if you come to an allergist and say, okay, I have lactose intolerance,
yes,
then it's an enzyme deficiency of lactase enzyme in your gut.
Right.
Allergy is reaction to the protein in the food. So they are two fundamentally different things. So you have an enzyme deficiency whereby you're not able to absorb the glucose or the sugar in your food, milk essentially. Whereas the allergy is the protein in the milk that triggers a reaction in your gut or your skin.
Right.
That's how allergy is different from intolerance, specifically lactose intolerance and milk allergy.
Yeah. Okay. And in intolerance, I kind of feel like you might know that you have a lactose intolerance, for instance, but you still might occasionally have a latte because you enjoy it. You know you're not going to feel great after you have that latte, but it doesn't give you an anaphylactic shock, for instance, like an allergy could.
Yes.
Yeah.
That's right.
Yeah.
So yeah, you're quite right. So you may have, say, partial deficiency of lactase enzyme.
Yes.
So you may be able to tolerate some amount of lactose in the food that you have taken. But if you go above a threshold, you will start having bloating, diarrhea, crampy kind of things.
Yeah.
Whereas with milk allergy, even a small amount of the allergen may trigger a very severe reaction where you may have breathing difficulty, you get sweaty, you get like clammy, you faint sometimes, you get eye swelling, face swelling, lip swelling, all those kind of things.
It's fairly immediate, isn't it?
Yeah. And so all these fast-acting reactions, the milk allergy or any kind of food allergy, we call them as IgE-based reactions. IgE is a molecule in our bloodstream that is a reflector of our allergic predisposition to a particular allergen.
Right.
Like say if I have peanut allergy, the IgE to peanut in my bloodstream would be high.
Right.
And if I eat accidentally peanut, then the IgE triggers a reaction which is quite quick. Yeah. Generally, reactions happen within 10 to 15 minutes, but we say up to 2 hours after you have been exposed to that particular allergen.
Yeah, okay.
So that's fast-acting ones.
Fast-acting, yeah, absolutely. And so if parents are trying to do the early introduction, what is the best course for that? Would you, when we talk about introducing food to babies, it's normally around the 6-month time. And how do you find, do you agree with that, first of all? And then with introducing allergens early, what is the formula that you suggest to parents when they're discussing that with you?
Yeah. So I'd like to go through again this in a little bit detail with you.
Yeah.
So if you have a baby who is completely well, growing fine, no eczema, nothing of that sort, you can do the introduction or weaning at 6 months of age. That's completely fine.
Yeah.
And then you can start introducing your fruits, vegetables, and then go to the allergens. But on the other hand, if you have a little one who has got severe eczema, early onset eczema that is difficult to treat from soon after life, they are at a real high risk of having a food allergy.
Right.
For them, there is a lot of guidance and evidence that states that if you can possibly introduce complementary feeding from 4 months of age.
Right. So
4 months.
earlier.
Yeah, early on. But that's provided your baby can eat it. Their head position is good. They can take the food. So if you have ticked all those boxes and you start weaning, then you have to try to get these allergens early on as quickly as possible. You do not delay them.
And so when we're talking about the allergens, Dr. Nitin, can you just list off for us which allergens you specifically like to make sure are targeted?
Yeah, so for me, the big chunk of allergies that I see is egg, peanut, and sesame.
Oh,
so I'm quite keen that if I see a baby who has got severe eczema and difficult to treat eczema, higher risk of having allergies, so I tell parents that once you start introduction of like weaning foods, get the vegetables, fruits quickly into your little one, and then go quickly onto these food items. Now, I don't want to medicalize food introduction like this much or that much, but the most important thing is small amounts of these things, but frequently.
Yeah.
Frequently is the way to introduce things because that helps your gut understand this is something that I can eat and not react to.
This is normal.
Yeah. Even small amounts is fine, but repeat introduction or repeat giving of these foods is vitally important.
Absolutely, I can understand.
So it's not like a one-off thing that you give one off and you say, okay, I'm done. It doesn't work like that.
So a little bit of egg every day.
Yeah, every other day, whenever you want to give, but 2-3 times a week. You want to make sure that you give your immune system a trigger again and again and again and again. And your gut retains the tolerance to be able to say, okay, I'm fine with this food.
Yeah. And I think that's really wise advice. And it's great for parents just to hear that these are the top 3 that you try to make sure their children are exposed to early. And when parents, it's actually quite a big deal for parents to deal with allergies and to have to, especially the children that have severe allergies, because parents are constantly having to be vigilant when their children are not in their own home, where everything is tightly controlled, when they go out to an outside environment into trying to ensure that their child isn't ingesting those things that they're severely allergic to. So what kind of advice do you give parents as their children are growing up and they are perhaps going on play dates and things and going to birthday parties about how to talk to their kids about, their allergy and to be careful about what they're eating?
Yeah, and this is a really, really important topic because no matter what we do in the clinics, the real life is outside when children are exposed to these things, schools, parties, clubs, after school areas, nurseries, all those kind of places, sharing foods.
Yeah.
So a child's understanding of allergy is important. Now, although children may be young, but some children have a good understanding of what are they allergic to.
Yes.
And this is a continuous discussion that parents, carers have with the children. Okay, you have peanut allergy. Make sure you ask your friends, is there any peanut? Yes. Make sure you ask your friends' parents, is there any peanut over here? So this is a evolving thing for a child to learn gradually, that they go into the house or a new party, new place where they have not been before, that they actually ask the child, ask the friends, ask the parents of the children.
Yes.
And that's also important on the part of the parent or the carer to inform wherever the child is going, be it school, be it nursery, be it playgroups, be it parties, parents, that they have to be aware that there is a child who has got an allergy and they need to be really cautious that these allergies can be life-threatening.
Absolutely.
Even small amounts of food that ingested accidentally can be life-threatening. So it's a real important thing that you have to convey across in no uncertain terms to the other person who's going to accept your child as a part of the party playgroups.
Yes, especially when the repercussions are so severe.
Yeah. So a part of my job as an allergist is to, one, help parents understand what foods can trigger this. So you can get a list of different things. There are sometimes hidden items. Yeah. And you have to look at the product labels for each and everything that you buy from outside, because reading allergy labeling is very important.
Yes.
for everyone who is looking after the child.
There's just so many ingredients in things nowadays, isn't there?
So the law generally highlights that the allergens are written in bold. Either they are in black or bold in allergy labeling across the world, most parts of the world actually. So in Europe, it's a pretty standardized kind of thing that you have a certain number of allergens. If they are in the food, they will be highlighted.
Right.
Over here, you get foods from all different parts of the world.
Yes.
So you have
the
to be-
labeling laws are, whatever country it's coming in, it's
So you have to be even more vigilant
Yes.
in trying to pick up what is the allergen and what is the Latin name of the allergen sometimes. That's what you have to find out.
Right.
So these are really important. And I also sort of give them a handout of what is called as allergy action plan. So in case inadvertently, if the child were to have an allergic reaction, how would they understand whether it's a mild, moderate, or severe reaction?
Right. Yes.
And how would you treat that?
Right.
Because the treatment of mild, moderate, or severe reactions is different.
Yeah.
And that is something that I teach parents before they go. And each time they come in, I reinforce the same thing over and over again.
Oh, that makes perfect sense. Is you need to be educating the parents in how to deal with a situation if it arises.
Yeah, and that allergy action plan is something that parents take with them everywhere.
Yeah.
So it should be on their phone, both parents,
Yes.
nannies. If the child goes to nursery, school, it should be with them.
Yes.
EpiPen should always be with a child who has a food allergy. EpiPen is the adrenaline pen that is given in case of severe allergic reaction. We call this anaphylaxis, where you have breathing difficulty, where you have involvement of your heart and blood pressure, such that you become pale, gray, sweaty, you faint, all those kind of things.
Yeah.
So EpiPen is the first line treatment. It's a lifesaver. And parents, carers are trained how to give the pen in case of emergency, and they always carry 2 pens with them everywhere, wherever they go.
And Dr. Nitin, just out of interest, is it easy to use an EpiPen? Like if a child was in a terrible situation and somebody picked one up to try and help them, that was untrained in how to use one, are they a difficult thing to administer?
People need to be trained.
They
Whoever
do.
is looking
Okay.
after the child. It's a very easy thing to administer. It's a very straightforward thing, but they need to be trained.
You need to know the steps.
Yeah, you need to know the steps. I commonly have a trainer pen with me in the clinic.
Yes.
So I teach the parents how to give it. So they
Great.
use the trainer pen on themselves or the child, and then
Yes.
they have a little bit of an idea of what to expect. And then I share with them some videos how to sort of give the pens. But this is a vitally important thing for every parent, carer, nanny to be fully aware of how to administer this pen.
Yes, absolutely. I can't imagine, because in an emergency situation, you don't want to be learning. You need to be feeling really confident about how you're going to deal with that situation to be able to, assist your child as well as you possibly can.
Exactly. An interesting bit is that some children actually get up to understanding it themselves.
Yes.
Some children actually like to know what is going to happen. How is the pen going to be administered?
Yeah.
And sometimes I see a lot of young people just trying it on themselves, the trainer pen.
Yep.
Not the actual pen, but the
I
trainer
think that's
pen.
probably, that's a healthy interest to have, like when it's your life to feel like you have some control, and understanding. And so with there being such, quite common now to have allergies, are there any new therapies, inventions that you think look promising for the allergy world?
Yeah, there's research going on all the time.
I
And there's
bet.
a lot of fantastic stuff going across the world. So a few things that are actually being done at the moment is oral immunotherapy, where you introduce a small amount of allergen into your child and in incremental doses over a certain length of time.
Yes, I've heard about that, Dr.
Yes.
Nitin. It's like micro-dosing
That's
in a way,
right.
isn't it?
That's right. So it's a technical way of giving it, and it has to be given under controlled environment with someone who actually does it or who is trained to do it.
Yes.
And it involves taking small amount of doses incrementally. You take one dose in the hospital and then you take a remainder for you take the same dose for a couple of weeks at home, and then you come for increasing the doses gradually over time. What it has shown us, or what the research and evidence points out, is that it allows you to become a little bit more tolerant to the food allergen. It does not cure your allergy, but if you were to inadvertently eat it somewhere, then you will not react to it.
Yes. So we're talking about, for instance, if I had a peanut allergy that was diagnosed, then you would introduce tiny amounts of having the peanut to try and lessen the severity of the...
Yeah, that's a principle, but that's depending upon whether you are a suitable person for immunotherapy, first of all. It depends
Right.
upon your blood test results, your other clinical parameters, and then it has to be done in a very controlled environment.
I'm sure,
So
yes.
there's a pathway, a very strict clinical pathway of how it has to be done, how it has to be
Yes.
implemented, the support
Under
systems in place.
supervision, yes.
Yeah, so there is a very few places in the world to do it. And it is something that is really helpful for parents if they can get this child to go through this oral immunotherapy protocol, because evidence points that over time, if you go through this oral immunotherapy fully, then your ability to tolerate a certain amount of that allergen,
Yes.
you will become tolerant to a certain amount of it. It'll not cure you,
Yes.
but if you were to say eat a cookie that has a little bit of, say, you have peanut allergy, you have a peanut cookie, inadvertently you eat it, you will not have a life-threatening reaction.
Yes. It just won't be as severe.
You may not react at all for that one bite.
Right.
It all depends upon the amount of allergen you have consumed, but
Yes.
a bite or so will not cause you any problems.
Yeah.
That's the whole aim of this food immunotherapy at the moment. But the other things also coming through, like patch. So there's a patch that's coming through that will be applied on the skin.
Right.
And you will be basically absorbing the allergen through the skin itself by the patch.
Right.
So there are phase 3 trials going on in the States. So let's watch the space.
So is that the same kind of thing, like a micro-dosing situation, but just using a patch instead of actually having to...
That's correct. So there's
Right.
lots of stuff coming through. World of allergy treatment is expanding widely across the world.
I'm sure, and it's nice to know that there is maybe some hope out there to help people that do have allergies.
Absolutely. We're all looking forward to that. Some really good science coming through to help us cure allergy, hopefully in due course of time.
Yes. And so for any parent that is like maybe noticing and suspecting that a child might have an allergy, what's your suggestion to them, Dr. Nitin? Like, what's step one if you're suspecting your child might have an allergy?
Yeah, the first thing is to have a discussion with the allergist.
Yes.
So clinical history of allergies is vitally important. The presentations of allergy are so common with so many things that you have to take a really detailed history of what's going on when a child consumes that particular food product or is exposed to that food product. And then you have allergy testing. So you have two kinds of testing that are available. One is skin prick testing, where you put the allergen on the skin, touch it with like a tip of the needle, and wait for 15 minutes to see the response.
Right.
If there's a bleb that forms, it just tells you you're more likely to react. We measure it according to, there are certain parameters we measure. But that's a very safe, easy to do, and a well standardized approach to finding out whether you are at higher risk of getting an allergic reaction if you're exposed to the allergen. The other thing is a blood test. We call that as a specific IgE blood test to a particular allergen that you're reacting to. If the IgE is high, as I mentioned to you before, then it tells you that you're possibly going to react. But again, it's not a confirmation that you have an allergy. It just tells you the likelihood of you reacting to an allergen.
Great.
It's all risk stratification based on the results.
Okay.
And that's where the allergists come in.
And so, Dr. Nitin, you are based at King's College Hospital, London in Dubai.
Yeah.
And so any parent that is, suspecting an allergy can certainly come and visit your team or see an allergist elsewhere. And I know you have an amazing team at King's.
Yeah.
And there are some promising treatments out there that keeps things hopeful for families. So thank you so much for joining us today. It's been such a pleasure to talk to you, and I'm sure that we'll probably want to have you back again another time to talk about allergies.
Thanks ever so much, Leah. It's been a real pleasure talking to you and helping me share my experience with the people around. Thank you.
And here come the legals. Our podcast is purely brought to you for educational and entertainment purposes. We are just two hectic mums, and we are certainly not licensed therapists.
This podcast is not intended as a substitute for the advice of licensed or qualified professionals. And if you do need some help, please seek out some professional advice.